Sue, we're live. Susan, did you leave me?
Oh, I'm sorry, I was still muted. I was chattering away to you. Sorry. Yes, we are live and we have resumed recording.
Okay, I'm going, did you leave me, Susan? Okay, good afternoon, everybody. Good afternoon. I want to welcome you back to the Health Subcommittee briefings with the agencies. This afternoon, we have the Department of Veterans Affairs at 1 o'clock. At 1:30, the Office of Chief Medical Examiner. At 2 o'clock, Office of Healthcare Strategy. And at 2:30, Department of Mental Health and Addiction Services. So with that, I would like to welcome the Commissioner from Department of Veterans Affairs. Good afternoon, sir. How are you?
I'm well, Representative Walker. Thank you very much. Senator Austin, ranking and esteemed members of the Appropriations Subcommittee. Thank you for the opportunity to speak with you today and answer some of your questions. For those who don't know me, Commissioner Sadi from the Connecticut Department of Veterans Affairs. I am also a U.S. Army veteran and still currently serving in the U.S. Army Reserve, and have been in the position at the DVA as commissioner for approximately 3 years. Prior to that, served as chief of staff and general counsel to the agency for 2 years. If I may, Madam Chair, Madam Chairs, to introduce the team that is with me today. With me, I have Ms. Brianna Mitchell. She is the Department of Veterans Affairs Chief Fiscal Officer. Ms. Mitchell has been in that position since the retirement of Mr. Clark. Mr. Michael Clark, many of you know him, last year in October. And also with us today are Mr. Matthew Pulowski, a new addition to the DVA fiscal team who came to us from OPM. He is the fiscal administrative supervisor within the DVA fiscal team. So I'm glad to have them with me today. And they, as well as I, are prepared to respond to any questions you may have. I did provide written testimony as directed by the committee. And thank you for that opportunity, Representative Walker, Senator Austin, and members of the committee.
Thank you, sir, and thank you for joining us today. I'm going to start right in with some standard questions that we ask all the agencies. One, you have approximately 240 employees currently, right now. Is that true? Are all vacancies filled?
All vacancies are not filled. We are in the process of filling many of our vacancies. Madam Chair, as you may know, with HR centralization and some of the resets that occurred with DAS last year, there was some delay, administrative delay. So we're in the process. We do have several vacancies that are still out there. The list hopefully will be closing soon on the Connecticut Job App site, and we'll be filling those. We do have, I believe, 275 full-time positions, but approximately, and this is just an approximation, probably about 20 or 25 vacancies. We're in a process of filling them each and every day.
Okay. And with the expectation of the number of people that will be retiring within the next 2 years because of their ability to hitting the pensions, I wondered, have you any idea how many members are you possibly going to lose once that cliff comes to our state?
The estimate and working with our internal analysis as well as with DAS are those that are for regular retirement, I believe is in the range of about 15%. And then almost times 2 that for those for eligible possibly for the reduced retirement. That being said, that's the number of eligible. It doesn't mean that we have identified them as indicating that they are going to retire. Mm-hmm. So we are leaning forward in that process to look at where we would have those potential retirements, working at streamlining our recruitment process with the HR centralization pods at DAS, trying to make things more electronic so that we can move quicker in filling vacancies. And while it is always very difficult to lose that institutional knowledge to retirements, I also do look at it as opportunities to build new teams going forward and to sometimes have a new set of eyes on things, to do things in a different way. Not saying that anything in the past was necessarily wrong, but it does provide opportunities. And as an agency, whether it's myself in the chair or somebody else down the road as commissioner, look at it as an opportunity to continue to improve agency operations.
Awesome. Awesome. Well, thank you, sir. And now let's go to my chairs. Senator Austin.
Four bills on consent.
Commissioner, I just want to welcome you here to the Appropriations Committee. I have no questions right now. Any questions I have, I'll bring to the working group. Thank you, Madam Chair.
Thank you.
Thank you, Senator.
Senator Minor.
Thank you. So my questions have to do with what I'm sure is going to be another difficult year with regard to COVID deaths and how they have impacted the agency and how they may impact the agency in terms of the budgetary projections.
So just to take a quick step back, Senator, at the DVA, we instituted early on in late February, early March of last year, a series of broad-based COVID-19 mitigation protocols. By mid to late March, they were codified into official agency policy that I issued, and they're under a series of procedures and practices to enforce those protocols related to screening, testing, now vaccines, social distancing, mask wearing, and the way the agency would operate, since we are basically 85% direct care staff. We don't have the opportunity, most of my staff, to telework. So with that being said, we were aided with funds from the CARES Act, which helped us to both cover some of the overtime, additional cleaning and hygienic practices, as well as the establishment of 2 COVID-19 isolation and recovery wings, one in our residential facility and one in our healthcare facility. Both of those remain operational. Those were fixed one-time costs. We are now able to staff them within our existing appropriations should we have an increase or an uptick. In fact, right now, and I apologize, my internet is a little unstable at this moment, so I'm going to continue speaking. If I do break up, again, my apologies, that we continue to utilize those wings for protective isolation at this time for veterans who have traveled out of state or because of potential community-based contact tracing. We do not have any COVID-19 positive veterans or staff on campus, and our COVID-19 veteran point prevalence testing has been clean of COVID in over 6 weeks. We do believe we can operate within the governor's proposed budget, given that we now have, I would say, efficient and well-oiled procedures for COVID-19 mitigation. There could be unexpected upticks that may require us to reach out and ask for additional help. But at this time, we are actually drawing down on some of the overtime as well as supplemental contract staffing or per diem staffing that we had to supplement our COVID-19 operations and moving more towards regular operations. One other thing, Senator, just to let you know, we have done the staff. My heart goes out to them and my hat is off to them for their hard work. Out of 240 veteran patients and residents that resided with us during COVID-19, a total, and this is a number we wish there was 0, but 5 passed due to COVID-19 out of 240. Of the 68 who tested positive, all but those have recovered and returned either to our facility or are now moved to the next positive step in our life, to community-based housing, employment, and reconnection with family. So we have thankfully done well, notwithstanding the sad losses that we did have. Thank you, Senator.
Thank you for that. And with regard to the line items that handle burial expenses and headstones, I keep thinking that the population that we talk about most in terms of passing is in that age bracket, may very well have served. Any sense of where those 2 line items stand and where they are projected to be going out into the future? Is that, again, something that the governor's budget should have sufficient resources?
We do. In the proposed biennial budget, we do have sufficient funds to cover, and Ms. Mitchell can correct me if I'm wrong, I believe it is $100 or $125 reimbursement for the headstone expense. Keeping in mind, Senator, that does not relate to the Veterans Cemetery. Those are for reimbursements for community-based burials, and that there are separate funds as well as federal dollars that come in as a cemetery plot allowance to the general fund to help offset cemetery expenses. So we do have enough. There has been some requests in the past for an increase in the actual dollar amount of that reimbursement, but right now we are flat funded. So based on a 125 reimbursement, we do have sufficient funds. And Ms. Mitchell, can you just verify that's the case through the chair, if I may?
Thank you.
That's correct, Commissioner Savi. This is Brianna. Those numbers are correct.
Thank you.
Thank you. Representative France. You're still muted. Representative France, you're muted.
Is that better?
Yep. Thank you.
Use the microphone source again. Gotta love Zoom.
Yep.
Thank you, Madam Chair. Thank you. Welcome, Commissioner, to the Appropriations Committee. Appreciate you being here. I just have one question related to in reviewing your testimony. In the last paragraph, you state you have a capacity for about 100 additional veteran residents and patients, and you're looking at opportunities of how to engage that community to find it, because you see potential growing need as the CARES Act funds expire and these people. So I guess the question I would have is, my experience is that a lot of the response is kind of a passive act, and people walk into the Veteran Service Office either on the base or somewhere. So I guess, how are you going to identify the individuals and then reach them directly to ensure they understand what's available and the opportunity that they have to meet the needs that they have in the community?
Thank you, Representative France, for that question, and I appreciate you highlighting that in the testimony, because that is one of our main challenges. There's a multi-faceted or multi-avenue approach that we're taking and expect to take. With the increased capabilities of being able to meet in person, hopefully, and knock on wood, as we go through with more vaccinations, better weather, as well as some adjustments in the executive orders, I plan to have the agency do just that, engage in more in-person, direct communication and events, similar to the way we did our stand down during more of a height of the pandemic back in September, when the numbers were starting to increase through smaller but in-person outreach. Also, our Veteran Residential Services Director has been engaged more actively with the Connecticut Coalition on Homelessness, as well as other community-based homeless advocates outside of our normal, the regular realm, to try to identify areas or pockets where there are veterans that we can reach out to, provide them with the information electronically and in hard copy if necessary. In particular, because even though some of those are getting are housed through the CARES Act or other means, they may not be receiving the wraparound supportive services that the DVA has to offer. So simply being housed when someone is in crisis, candidly, is not enough from a best practice. You need to be housed as well as get those supportive services. We've also been conducting Zoom and team meeting town halls with community stakeholders, with the federal VA, just through every avenue of approach. There is some other legislation pending before the VA committee with regard to adding a question, are you a veteran, to some state forms. And if they are a veteran and are in need of or interested in programs or services, to then have that information provided to the DVA. That would also be helpful, or something along those lines, whether legislatively or as a pilot program. Other states have done it, and they refer to it as the Have You Ever Served campaign, or the No Wrong Door, to refer individuals to the DVA, and then we can do that warm handoff, federal VA to municipal vet reps, or handle their issues in-house if we have the program or service they are eligible for.
Thank you for that. I think those are good approaches. I think I guess I'm a little surprised that we didn't already have that information on the form to interface with your agency. I guess the second part is several years ago, the legislature established that every town would have a veteran service officer assigned. What kind of interaction are you having with those individuals to try and help identify those veterans in need in their communities? So I would presume that part of that role of who was assigned by each town would be a connection with the veterans in that town to help identify those people.
Absolutely. That's the municipal vet, commonly referred to as a municipal vet rep program. Sometimes they're individuals, dual-hatted employees of the municipality or volunteer veterans. We communicate with them at least once a month through email distro lists, where we provide, the DVA through the Office of Advocacy and Assistance, updates regarding each of our 4 core functions, as well as when we hold town halls, whether Zoom or Teams. That information is sent to every municipal vet rep point of contact that we have. Generally annually, if not, sometimes every 6 months, we send out a survey to update that information. Is a lot. The contact information does change. We also oftentimes will copy the chief executive officer of that municipality on those communications, just in case the municipal vet rep is not there or has been replaced. One area that we have not been able to do is the in-person training, which we generally would do annually for all municipal vet reps and veteran service organizations. We did have a virtual training that we conducted, and then hope to continue to do that and to hopefully get back to in-person municipal vet rep training, which is part of the statutory requirement. So we do utilize them as points of contacts into the community, but they too are learning how to operate better in a virtual world, in particular where the demographic that is often most in need is oftentimes that demographic which is least connected, unfortunately.
Very good. Thank you, Commissioner, for your answers. Appreciate it. Thank you.
Thank you,
Madam Chair.
Thank you, sir. Senator Abrams, I don't think, is she on, Senator Abrams? Maybe not. Well, if she comes on, I'll give her an opportunity. Representative Dillon.
Thank you, Madam Chair. Good afternoon, Commissioner. Congratulations on the completing the complex task of conversion that had taken some perseverance on your part, I would say. I guess we don't need to discuss it now, but I am really interested in the capacity issues that you identified and the outreach, if there's any way that we can help you with that. But also because this was a sticking point during the I can't remember the name of the Iraq, was the Operation Freedom. There was some sticking points about the definition of veteran, not on our end, but because some people who clearly were not returning to theater were not discharged, especially by the Army. And I guess I wanted to know if there were, I think it was to keep, well, some people thought it was to keep their numbers up. I don't know what was going on, but there were some people who had come back here and they were really probably not going back. Is that resolved? Has everyone that either had bad paper, by the way, or was had difficulty getting discharged, have they been taken care of so they can access your services?
So let me go back one step. First of all, very nice to see you, Representative Dillon. And let me take a step back to the issue of the transition or conversion of our healthcare center from chronic disease to skilled nursing. Just so everyone is tracking, we did complete that very complex and highly involved process, both across the clinical spectrum as well as fiscal. And so now we are a fully licensed and Medicare, Medicaid certified long-term care skilled nursing facility. And we do have capacity to take on additional veterans within that facility. And so one thing, going back to what Representative France mentioned and Representative Dillon about the outreach, is but something that you can do. And I'm not trying to advocate from a marketing standpoint of an agency, but feel free to share the link to the DVA website, in particular to healthcare and residential programs and services with your constituents. They may not need the services, but a friend, a relative. And please note that the only residency requirement is that you are a resident of Connecticut. No longer do you have to be a resident for 2 years and these other indicia of residency. So long as you are a resident of Connecticut and an honorably or general under honorable condition discharged veteran, which leads me, Representative Dillon, to the other two issues. There does continue to be changes and updates to the issue of the other than honorable discharge characterization. As you may recall, in 2018, we created qualified conditions. So individuals who received an other than honorable discharge, which generally precludes them from veteran benefits, programs, or services, if it was based on or reasonably linked to PTSD, TBI, or being a victim of military sexual trauma, for Connecticut benefits, they could be certified to be eligible for Connecticut benefits. And there are some bills pending before the VA committee, which would expand that a bit further, including for those who were discharged under Don't Ask, Don't Tell based on sexual orientation or gender identity. And I spoke in favor of that expansion before the VA committee. With regard to the status of discharge and individuals trying to get their paperwork, I am not tracking at this time that there is a very large lag time. There may be, and I can only tell you, it took me 6 months. As some of you know, I was on active duty from late 2019 till mid 2020. It took me 6 months to get my DD-214 because of COVID and offices being closed. So it does happen. If you or other legislators are aware of that, please bring that to our attention at DVA and we will work. But that is not now based on not wanting to have people discharged. More of it is administrative slowdowns due to people teleworking and the inability to conduct post-mobilization physicals, things like that. I had to do mine through telehealth. So there may be some out there, but I don't think they're related to the underlying OIF and OEF issue, but now to residuals of COVID. I hope that answers your questions, Representative.
Pat, you're muted. Go ahead.
Thank you. I think it does, and I'm always concerned about having met some of the people who had bad paper. They had powerful stories, and they really had a very difficult time in theater, and it would be a shame, especially if you have the capacity, if they wanted to use your service and there was some barrier to that we could work through, and so that's important. And on the other issue, I did think there was a lot of chatter about the Army trying to keep their numbers up, but I think, as you said, that issue isn't really the issue before us now. It's funding people and making sure that they get what they really deserve, because some of them really had a tough time.
Okay, Representative Dillon? Yep, okay, thank you.
Yes, and one point, if I may, Madam Chair, just to clarify, please keep in mind that to the extent a state expands the eligibility for veterans benefits, that does not touch on federal benefits. So that any veteran who has what's known as bad paper, an OTH, another than honorable, bad conduct, or dishonorable, they would need to go through a federal process for a federal upgrade or recharacterization to get federal benefits. But from a state standpoint, what we can do is provide to those who fall in those categories, such as the OTH qualified conditions, state-based benefits.
Awesome. Well, thank you, sir. Representative Abercrombie.
Thank you, Madam Chair. Good afternoon, Commissioner, and thank you for being here. Thank you for your service. I have a question about the burial expenses. So could you explain how the burial expense works currently?
So again, and I will defer if I am stating anything incorrectly to Ms. Mitchell or Mr. Pulowski, that burial expense are dollars that do not go to the veteran cemetery for those expenses. These are for individuals who are considered indigent, and it's to pay for those burials. So that is very distinct. What often happens is burial expenses and headstones, people look at that as being part of our cemetery operation, which it is not. So Ms. Mitchell, if you could touch on that, just make sure, I need you to confirm that that's accurate, as well as, do we have a number of how many applications we receive annually approximately for assistance for indigent burials?
Commissioner, could you wait 1 second? Representative Abercrombie, could you mute while he's answering? Because I think we're getting feedback from you. I'm looking and nobody else is open but you.
Okay.
Could you just mute your mic just so I think we're hearing? Okay, there you go. Go ahead, Commissioner. Go ahead. Much better. Go ahead.
So I just want to ask Ms. Mitchell to confirm that the burial expenses in the budget line item are not appropriations for cemetery, but for indigent individuals. Same thing, the headstones are the reimbursement for community-based burials, again, not for our cemetery. And also on that, Ms. Mitchell, if you do know, or if not, we can follow up, Representative Abercrombie and others, with the actual number per year of indigent applications we receive. Ms. Mitchell, can you speak to that?
Good afternoon again. So Commissioner is correct. The burial expenses, that's based on an application for those folks that are deemed indigent. To date, this fiscal year, we currently haven't received any applicants looking to tap into those funds. The headstones line item is used for us to reimburse for headstones put in place in other cemeteries. Those, we can get back to you with those exact numbers at a later date and time if that's acceptable.
So you sort of answered my question, because what I was leading to was, if any of these deaths were due to COVID, and were you receiving any of the COVID burial dollars that the state's receiving? So according to Ms. Mitchell, it sounds like that there weren't any COVID related, which means you wouldn't apply for any of those dollars. Correct?
Madam Chair, if I could just ask if you were able to hear the question a little
Can
bit more
you
clearly.
hear me, Commissioner?
No, Kathy, your speed is slow, so we're not able to hear you. But I know what you're asking, Commissioner. There was dollars in the last COVID.
Commissioner, can you hear me?
No, wait. So in the last budget in December,
I'm sorry.
there were dollars in there for burial. I forgot exactly how much. I think it was like $43 million or something like that for people that died because of COVID in the state. So Representative Abercrombie is asking, were you able to tap into any of those federal dollars to help you out?
Those, and again, Ms. Mitchell can correct me if I'm wrong. When someone is buried at the State Veterans Cemetery, the general fund is given a plot allowance by the federal government, so there is not a charge for that plot. For the actual burial or funeral expenses, the family through the funeral home, if they were eligible, would be able to apply for that. I am not aware that as an agency we applied for funding for that specifically, and we did not have anyone request that, nor did we turn away anyone for a lack of ability to pay for burial. Finally, I think the dollars we utilized, COVID relief dollars, were from the CARES Act, specifically for our operational purposes, some overtime, as well as PPE and cleaning and hygienic matters. I don't believe there was any utilization of those dollars, but I will defer to Ms. Mitchell on that.
Here we go. No, Commissioner, you're correct. We did not tap into specific dollars associated with burials and deaths.
Okay, all right. It would be helpful if you would also provide us with a list of COVID dollars that you received this year, this past year, 2020, and up to now, so that and what were they utilized for in your budget? Thank you. Representative Datham, Representative Abercrombie, are you done? You okay? No more questions. Okay. Representative Datham.
Thank you, Madam Chair. Sorry, I'm doing two meetings here at the same time. Just wanted to have the commissioner bring to the working group, because I'm conscious on time, if he can plan on commenting on the effect of the human resources transfer. I know you spoke about trying to hire a whole bunch of people and that you were having some issues, and I'm wondering, with its transfer, has this, hurt your organization? I know your organization is very much a relationship building between the communities you serve and your team. And so making sure that we have the right people in those roles, I can see is super important. And I just want to know the effect of the transfer of the human that function outside of your agency, how that will impede your ability to carry out the effects of your agency, or is it actually been helpful? And again, thank you for all your work that you're doing for the veterans of our state. It's monumental in this time.
Thank you, ma'am, and thank you, sir, for your testimony. So we'll have the administrator send you any of the questions that we have from our membership, and we will. Representative McCarty, you got, I was saying goodbye.
I know, and I always wait till the end, but thank you very much, Madam Chair, and welcome, Commissioner. Just very quickly, and I really appreciate your testimony and what the department is doing. It looks like you're really trying to be creative within the department to save as many resources, but I'd just like to give you the quick opportunity. You mentioned on the residential program that you're using internal resources to try to modernize the living quarters and looking out and reaching out for other opportunities. If you could just maybe let us know what kind of dollars we're talking about in that particular project, and then maybe and I asked this on public health also, on the unexpended account category, if we could just have a sense of what projects are falling under that category.
Representative McCarty, can we have that submitted to us in the,
Perfect.
Because we've run out of time and we're now into the next.
Yes, that's perfectly fine. And I just wanted to thank the commissioner. Thank you very much.
Thank you. And I'll be prepared to speak to those items at the working group, as well as have documentation prepared to bring with me as well.
Thank you.
Okay, thank you, sir, and thank you for your testimony, and we look forward to seeing you in the follow-up subcommittees. Thank you, Representative McCarty. Thank you. Up next, we have the I believe we have the Office of Chief Medical Examiner.
Yes, good afternoon.
Good afternoon. Just 1 second. Let me just make sure we got do you have any, are you by yourself, or do you have any members with you from your office?
I have my Deputy Chief, Dr. Maura DeJoseph, and my Head Administrator, Dr. Dwayne Gordon. They're both in the room.
Okay, all right. Are we ready? So just to let you know, we ask that you've already done it, introduce your staff, and then we go right into the questions. And every member has the ability to ask 2 questions, and if they need more, then they can come back towards the end of it, so that we can give people opportunities to get some of them in. And then some questions we would talk about in our subcommittee. Some, if they're brief, we can talk about them right now. So with that, I will get right into the questions, if that's okay with you.
Fine with me.
Okay, great. So I looked in, and you have a I believe you have a lapse or deficiency in your department. Could you talk to me about that in your office, please?
Sure. I will have Dr. Dwayne Gordon can talk about the budget matters for us.
Yeah, it's a $500,000, $500,000.
Yes. Good afternoon. My name is Leakin Gordon. I work for the chief. The recognized OPM deficiency that we have at this agency is our personal services. We're showing a small deficiency for OE. We're hoping that that will resolve itself and we will not be asking for money. The primary driver for that is we did not ask, as an agency, we did not ask for enough money in the current biennium to cover for overtime and shift differentials. In addition to that, the trend of the amount of overtime we were using to staff what we needed in autopsy, as well as when we send our staff on the road, was going up, was a trend going up. And the differentials of how we pay the doctors for off hours, that also went up, where we had, I believe, we've moved to 3 doctors on Saturdays and 3 on Sundays and on holidays to keep up with what we're producing in terms of work. And that is the primary driver.
Okay. Okay, and I'm going to go to the last page of your testimony. No, I'll pass. I'll let other people ask. My other question is, if you received COVID dollars or CARES Act money over this past year because of the pandemic, could you please send us a breakdown of the dollars that you received and from what trust that you got it from and what it was to cover?
Yes, I will respond to OFA on that. That's easy.
Okay.
I'll send it out today.
Okay, and you send it to Susan Keene, the administrator. That's okay. That's all right. All right, Senator Austin.
I have no questions right now. I'll look forward to seeing him in the work group if we have any other additional questions. Thank you.
Okay, let me just see. Senator Minor's not on. Okay, Representative Dillon, followed by Representative Candelaria.
Thank you, Madam Chair, and thank you, Commissioner, for the difficult work that you've done over the past years. I wonder, for the work group, if we're trying to understand, and first, I don't think that your department has always gotten what it needed, you know, and you know that. And it was hard for us to keep up sometimes, but also some decisions were made at another level. In your testimony, you mentioned that homicides are up 30% and drug overdoses are up 13%. I wonder if, not now, but separately, your staff could provide us with the trend over time on the drug overdoses, because that 13% increase, we've had increases over the recent years. In one year, we had a dreadful problem, so that I'd like to understand what base you're operating over for the 13%, and of course, the 30% increase in homicides is just horrific. But if you could provide us with that data, it sounds like you have a case for more resources. And I guess if you could, your folks, depending on how well the interplay is, if your folks could provide us in the working sessions with some information that would help us to make good decisions about where any new resources should go, that would be very helpful.
Yes, thank you. On table 1, we do list the last few years for the drug overdoses. So you can see in fiscal year 2017, it was just over 1,000, and now we're over 1,350. For current practice levels, one medical examiner should be doing 250 autopsies a year. We have 7 medical examiners, and 5 of them would just be doing the drug intoxication overdoses. And that's fewer than half of our autopsies. So you can see, I think, just from that, why Dr. DeJoseph and I both have to also do autopsies as well to try and keep up with those deaths. So it really is a staffing issue.
Are you finished, Representative Dillon?
Yes, thank you, madam. I didn't have his testimony in front of me,
Okay.
but I'll review it. But I would like as much information as possible to see how we can help you.
Thank
We will
you.
send you those numbers.
Thank you. Representative Candelaria.
Thank you, Madam Chair. I think that the same lines as Pat Dillon. I know that the pandemic has had a big stress on your department as well, and the increase of people with isolation, suicides. We've seen an increase in shootings. I'm looking at your budget, and I see the agency made a request, and the governor made a different recommendation. Can you talk a little bit about that? What's the additional dollars? What we will cover? If it was already covered, you don't have to repeat yourself, because I'm going in 2 meetings right now. I have 2 meetings going at the same time. But if you already answered the question, you don't have to. I'll go back and look at it. But if you can address it, if it hasn't been asked, what would be the difference, and is it for additional staff?
Yeah, in our initial proposal, we asked for 3 additional staff, including another medical examiner, another investigator, and another laboratory assistant. And we didn't get the full funding for those 3 positions.
Now, the volume of cases that you're looking at now compared to the prior year, can you talk a little bit about what that number looks like?
Sure. Well, when I started here in 2013, the office was doing about 1,400 autopsies a year. We're doing 2,900 autopsies a year now. So we've doubled in those years. This facility was built 32 years ago for 1,300 autopsies a year, and now we're doing double that. So we have storage issues. We don't have enough autopsy tables, and we're addressing that as well, looking for facility expansion. But the staffing is right now the key issue.
Thank you. Thank you for those answers. Thank you, Madam Chair.
Thank you, sir. Are there any other questions? Representative McCarty.
Trying to go a little faster this time. Thank you. And thank you, Dr. Gill, for being here today. And just following up on the previous speakers, would you also be able to include for the working group your comments about how the staffing relates to keeping the national accreditation in place? And I think you make a very good case for when you provide the statistics on the increase in the overdoses and throughout the pandemic. So I'm just curious, because I know over the years we've been worried about the accreditation piece. So I would appreciate that. Thank you.
Thank you, ma'am. Sir, when I was looking at your numbers, the last tranche of dollars that was handed out by the federal government, they had dollars in there for burials, and they did it by the number of deaths they had, and I'm assuming that's the number of deaths that were up to December 31st, and Connecticut had 5,924. So I'm looking at your numbers. So the certified deaths you had were a little less than what they had on record. I was curious to ask where, I don't know where they got their numbers. So your numbers were strictly the total number of deaths in the state of Connecticut?
No. So not all deaths get reported to our office. So on an average year, we see about 2,500 deaths a month. In April last year, we had just about 2,500 COVID deaths in addition that month. So I think that's probably looking at the COVID deaths and not necessarily all of our deaths.
Okay, and you also you get reimbursed $150 per cremation. It says cremation revenue.
That goes to the state general fund. So we do cremation investigations on any body that's going to be cremated to make sure that it's not a homicide or what have you. And actually, during that cremation review process, we've identified many deaths that were COVID deaths that were not certified as COVID deaths. We went to funeral homes and swabbed people at funeral homes and identified COVID deaths through that mechanism. So the $150 fee goes to the general fund, not to our office.
That's correct.
how many people do you have out there going around verifying the deaths? How many?
We have about 15 investigators. They're on 24/7, 365 days a year. And they have to go to the homicide scenes, all the death scenes. And so when we have a death at a funeral home where, for example, we'll get a death certificate that says respiratory failure. That's not a competent death certificate. And if we find out the person's from a nursing home, we're going to investigate that more and go to the funeral home and do a swab. And we've amended many death certificates that initially were not certified as COVID.
Wow. Okay. So the total number of COVID deaths that we've had so far in Connecticut is how many?
Approaching 8,000.
It's approaching 8,000. Okay. Huh. Okay. Any other questions from any other members of the committee? I think we did very well. So thank you very much, and we look forward to talking to you if we have any follow-up questions. So thank you, sir. Thank you very much.
Thank you.
Have a good day. So we are a little ahead in our calendar, our schedule today. We have the Office of Healthcare Strategy. Madam Administrator, do you think that they might be able to come in earlier?
I can try and reach them.
All right. Well, we'll stand at ease until we hear from you.
Okay, thank you. Madam Chair, we have the team from the Office of Health Strategy on.
Oops, sorry. Thank you. Good afternoon, ma'am. How are you?
I'm good. How are you, Representative Walker? It's good to see your face.
Good to see you. Good to see you. So the way we do it is we let you ask you to introduce your staff that you brought onto the Zoom. And then the chairs, then we ask all the members to do no more than 2 questions. And if they haven't gotten all their questions, they can come back if time permits. So with that, I'd like you to introduce your team.
Thank you so much. It's great to see everybody. So good afternoon, Representative Walker, Senator Austin, Senator Minor, Representative France, and the members of the Health Subcommittee, Senator Abrams, Representative Dillon, Senator Summers, and Representative Kennedy. I'm Vicki Veltri. I'm the Executive Director of Connecticut's Office of Health Strategy. I'm very happy to be here this afternoon. I hope my team has joined with our Deputy Director, Kim Martone, our General Counsel. Oh, she's there. Good. And our General Counsel, Damian Fontanella.
Yep, he's
and
there.
Our Fiscal Officer, our Associate Fiscal Officer, Christine Nguyen Matos. That's the team that we have here today to answer questions for you. I will say it's nice to see everybody's faces and be able to interact. I wish we could do it in person, but I'm happy to at least be able to do it this way.
At least we can see each other and we're smiling. So that's
yeah.
and it's not snowing. So
that's right.
Yeah. So I thank you for coming today. And if we don't get to all the questions, what we'll do is Madam Administrator will send them to you, and we can work out a time and everything for that. So I'm gonna start off with a couple of questions very quickly. First of all, in the write-up, it says that the governor, under Executive Order 5, in January of 2020, established the healthcare advocate of the Office of Healthcare Strategy. Is that correct? The reason why I question is because we weren't going through that at that time. He wasn't doing executive orders.
Well, actually, so the Office of Health Strategy has been around for now fully put together since 2018. Was initially passed in the fund session that ended in October of 2017, as you remember. But 2018 was when the full office came together. Governor did issue an executive order at the beginning of, it was before COVID hit. So it was January 22nd, 2020. He issued executive order number 5, which did create or charged our office with creating healthcare cost growth benchmarks, primary care target, and quality benchmarks. So yeah, it was issued then.
Okay, I did not know that. I have to go back and do my executive order homework, because I didn't think that he had started doing executive orders before the pandemic. So that's my error. So in this year, you have 30, well, the governor is recommending 30 people for your staff. So of those 30 people, there is 7 additional positions. Can you tell me what the 7 additional positions are?
Yes, those are 7 positions that are now being reflected in the position count, which were already in the office as the result of our health information technology work. So that work is funded partially by the federal government and matched partially by the state. So they were added to the position count to reflect the fact that they've been part of the office.
Okay.
So that represents the 7.
Okay.
They're not all filled right now. A few of them, we're trying to fill a couple of them right now, actually.
So how many do you have vacant?
So at this moment, there's 2, there are actually 3 technically vacant. The HITO is a statutory position. That's the Health Information Technology Officer. That one has been authorized to refill. There's another one in process of being authorized to refill, which was a lead planning analyst. And then the last one is an AA, administrative assistant. That one we have not posted yet, but are in the process of. So that's for the 7, those 7.
Sorry, and those are the only vacancies that you have, correct?
Actually, we have 2 in process that are close to an offer. They were approved, interviewed, and are waiting for offers.
Okay.
In our health system planning unit.
Okay.
And then there's 1 in the insurance fund that's been vacant that we plan to fill. It's been vacant for a little while, but we're planning to fill it. We're just putting in the paperwork now for that one.
Okay, so could you just submit those, the information to Sue, because my notes
Absolutely.
don't represent what I think you told me. So
Okay, absolutely.
Just so that we can all have the same information, it would be appreciated. So let me go to Senator Austin.
Again, I have no questions right now. I'll go to the working group and ask any questions. Thank you.
Senator Minor.
Thank you. I have no questions at this time. I'll wait till it works.
Okay, thank you. Representative France. Can't hear you. Can't hear you.
Every time I go dark, I have to switch what the microphone setting is. Thank you, Madam Chair. Thank you, Commissioner, for being here. And you bring this to the working group session, but just to understand more about this health initiative exchange or information exchange, and kind of as an engineer, I'm looking at your benchmarks and your expected rate of growth for healthcare spending, and kind of bringing the basis for what those numbers are and how the program was established, a little more detail. If you could bring a report on that, how you arrived at those settings and why they're the right ones, that we're going to invest substantial amounts of money in establishing this program, so we can have better understand kind of the basis for what those are beyond what's in your PowerPoint presentation. Thank you.
Thank you. I'd be happy to do that. We actually have a full report that we will share with the committee ahead of time, so you'll have a chance to read it before the work session. And then we can
excellent. Thank you very much.
Answer any other questions.
Thank you.
Thank you, Madam Chair.
Senator Abrams. Don't see her on. Okay. Representative Dillon.
I spent a robust conversation in the work group. Thank you.
Okay. Okay. Are there any questions from any members of the committee? Wow.
Really?
Wow.
That's okay.
You gotta pass.
We're of course happy to answer any questions of the committee here and in the work session and whenever is convenient for people.
Wait. I see Representative McCarty. She just came up.
Always wait till the very end, but thank you, Madam Chair. And welcome, Vicki, and thank you for your presentation. My question, and I know Representative France just asked to bring the information to the subgroup on setting the benchmarks and looking at healthcare costs, but could you just tell me briefly, does that work happen within your office, or do you contract out for that information? And I know it's probably in the report, but I was just curious.
It's a mix. So there we have a couple of staff assigned to that work, and I will say cuts across a few streams. So there's the cost growth benchmark, then there's a primary care target, and then there's quality benchmark development. There are staff assigned to those, but there is a consulting. We have had a contract with Baylor Health, which is a well-known health consulting contractor that has experience in all 3 of these areas. But important, and we can talk about it obviously more in the work session, but there's staff. There is a level of also expertise in terms of claims knowledge, health insurance claims knowledge, analytics, the development of quality measures for measuring performance of providers and our healthcare system. And then there's also just understanding the ins and outs of detail of using the all-payer claims database versus collection of health insurance claims. And that's the reason for the consulting, which is identical to what every other state is doing in this process. So, and I was actually happy to hear a question from an engineer as a former chemist myself. So I'm always happy to answer questions that relate to numbers.
That answers my question, and I will look forward to the work at the subgroup. Thank you, Vicki.
You're welcome.
Thank you very much. So I guess we have no questions, ma'am. Did you receive any COVID dollars? I should ask that. That I ask everybody.
No, we did not.
You did not. Okay. All right. Well, thank you. And thank you to your team for being prompt and early. And I look forward with any of the questions for follow-up. So thank you very much, Vicki.
You're welcome. It's nice to see all of you, and we'll look forward to seeing you again.
Day. Thank you. Have a good day.
Take care. You too. Bye-bye.
Susan?
Yes, ma'am.
Did you contact Demas to see if they could come in earlier?
I'm doing it right now, actually.
Thank you.
You're welcome.
So we'll stand down for a few minutes and see where we are.
We are working on it, Madam Chair. Hopefully they will be able to log in within the next few minutes. Madam Chair, the commissioner and her team are here.
Awesome. Thank you. Thank you. Thank you. Thank you. Good afternoon. Thank you guys for being so flexible.
Oh, you're welcome. You're welcome.
The way we do it is we have we allow you to introduce your team, and then we go through the chairs and the members, and they're allowed to do 2 questions at a time. And then whatever we don't get covered, we then pass over to the follow-up subcommittee. And you're used to this, so I will continue later on. So with that, Madam, would you like to introduce your team? Thank you, Madam Commissioner.
Yes, yeah, thank you, Representative Walker. I'd be happy to introduce my team. So with me this afternoon, I have Nancy Navarrete, Deputy Commissioner of DEMIS. I also have Stephen DePietro, who's the DEMIS Fiscal Director. I also have Cheryl Aurora, who's the Director of Budget, and also Mary Kate Mason, who was our Legislative Liaison. So we're happy to be here this afternoon.
Thank you, ma'am, and thank you very much for being here. So a couple of questions that I ask everybody is, number one, did you receive dollars from any of the COVID federal dollars over the last year? And if possible, you don't have to explain them, but if you could bring those to the meeting or have them sent over so that we have them, that would be appreciated. And then, okay. And then the other information would be, do you have any vacancies in your agency that that you are intending to, or that you plan on filling?
Okay, so we can definitely bring that information. We did receive COVID dollars, several different grants, and so can bring some of that information. And we absolutely do have vacancies that we're looking to fill, and so can bring you some of that information as well.
I'd heard that you have about 390 vacancies. Is that correct?
We have, let's see, so vacancies that we're looking to fill.
Yes, Commissioner. That's right.
Yeah, it is. Yeah, 390 vacancies that we're looking to fill. Yeah, we've had a hard time currently recruiting some of our docs, also some of our nurses. That has historically been, 2 positions where we struggle with recruiting, but we're also short in terms of other positions as well. But certainly our doctors and nurses are areas where we're struggling with recruiting.
What is it the pay that we are what we offer is very low?
I think it is a number of things that also varies by geography. In areas like Bridgeport and Stamford, sometimes it is the pay. We're not able to compete with, in some instances, the New York prices or New York salaries that physicians and nurses and other healthcare providers are able to secure. So certainly the pay is, I think, part of it. But, quite frankly, I think an additional challenge is around just a shortage of certain positions. We know nationally there is a shortage of psychiatrists and providers that work with young people, that work with youth. So that's a challenge. But in general, psychiatrists across the country, there is a shortage. And so that's certainly one area that we struggle with bringing folks in.
If that's the case, then we aren't serving the communities that we're supposed to. So I think it really would behoove us to actually drill down into that with some detail, because we all know that, and I know I'm preaching to the choir, but mental health issues are on the rise, especially during the pandemic and with addiction, et cetera. And just basically dealing with the stresses that we all have to go through. So I would like the subcommittee to pursue that issue in itself in the subcommittee meeting that we'll have as a follow-up, because we don't want you to not have the staff that you need to do your job, because then they're saying that Demas is not doing their job. So the most important thing is for us to figure out what we have to do to help you be able to do what you are in delivering mental health services and addiction services, because we need them and we need them desperately. So but then you have a $9 million deficiency right now. Is that correct?
So our current deficiency is around there. I believe it's 8 million. Actually, Stephen, what is the exact number on that for our deficiency? Say
8.9 this current year, the current fiscal year.
That's
right.
Yep. So 8.9 for the current fiscal year. Thank you, Nancy.
Okay. All right. So and the deficiency is in what areas, can I ask?
There are several different areas where we have been challenged. So, in particular, professional services. So professional services is one area where we've had a bit of deficiency because we've had to hire docs while we're looking to recruit other doctors. So temporary docs or temporary nurses. We also have a shortfall in terms of OE, so other expenses. And, we've had to do facility maintenance and in some instances contract staff in some instances, so to do our screening at our facilities or even to help with some of the facility maintenance. Also workers' comp, that's another area that contributes to our overall shortfall. As well as discharge, so moving people from our inpatient facilities to community services and supports. So all of that has contributed to our overall deficiency.
Okay, all right. Well, thank you, and I may come back with some more questions after this. Senator Austin.
Thank you. I'm on 2 other Zooms. I really can't ask any questions right now. I do have a lot of questions for the commissioner. I guess mostly, I gotta go. I'm sorry.
Okay, let's see. Senator Representative France or Senator Minor, either one of you.
I have no questions at this point. Thank you.
Thank you,
Madam Chair.
Okay, Senator Minor.
Thank you, Madam Chairman. I missed the first part of this and I apologize. So did you go into some detail about COVID-related expenses?
No, I did not. I just talked about the 390 vacancies and then the deficiency that they're carrying right now. So you go right ahead, sir.
Imagining that this is a very labor-intensive agency, what COVID dollars were made available to help with either PPE or maintaining some level of COVID vigilance, I guess, in terms of cleaning and that sort of thing, were you able to take advantage of?
Yes, thank you. So we were able to receive quite a bit of COVID dollars. Received about 17 million in COVID release funds that we've been able to disseminate to our community private nonprofit providers, and some of that is still in process. So they've been able to buy supplies, cleaning equipment, PPE in some instances. We also have been supplying them with PPE. We've also received funds where we have allowed our staff to stay in temporary housing if they've been exposed, so as to not expose their families with COVID. We also applied for several grants and were successful in securing those grants. So one was a SAMHSA grant. It allowed us to buy or to fund Department of Corrections to support telehealth equipment We are also able to support additional FTEs at 211. And those individuals actually provided crisis counseling over the phone to individuals who called 211. So that was a really helpful grant. And then we also were able to enhance EAP services for our community providers. So that was one SAMHSA grant we received. It was about $2 million in 2020 and $2.8 million in 2021. We also received a grant, it was a FEMA grant, and then later became a FEMA SAMHSA grant, where we've been able to develop and put in place a public awareness campaign and a whole initiative we call our Connecticut Coach Initiative. That stands for COVID Assistance for Community Health. Essentially, if people call the coach line or through 211, they can be connected to really a live person that will connect them with other COVID-related services and supports. So that's one initiative. We were also able to bring on a number of different crisis counselors that are working in some instances with some of the individuals that have been moved to the hotels or individuals who are in assisted living facilities, as well as staff, so residents as well as staff. And then we also have a collaboration with faith communities where we've been able to bring on, I believe, 12 or so crisis counselors that are working through different churches around the state to be able to provide crisis counseling services in diverse racial and ethnic communities. So those are just some of the resources that we received. We also, through the Coach Initiative, have been able to support well, actually, yeah. So a public awareness campaign that has sort of live individuals that people can connect with through the website as well.
Thank you. And so my my last question, I continue, and I think we all do, continue to get emails and phone calls from people concerned about the vaping situation.
To whom shall I send it?
And so my question is, I know there's money in the budget to deal with the potential for legalization of cannabis, but it kind of comes at a time when people are still very much concerned about tobacco, smokeless tobacco, and vaping products. And I wonder if you could tell me what kind of plans you have in place as part of the current budget that's proposed to kind of step up kind of the surveillance and other activities that might be helpful in trying to bring, at least with regard to youth, bring the numbers down.
Yeah. So do you mean, Senator Minor, in terms of the vaping piece or the marijuana? I know you mentioned.
So the marijuana seems to be budgeted, right?
Yes.
But assuming that there's no change proposed by the governor for the other issues that continue to fill up my inbox, my question is, what are the agency's plans with regard to the staffing as you currently have it to increase the activities to try and reduce youth vaping and starting the smoking and the smokeless tobacco?
Okay, thank you for that question. Yeah, so we do have a pretty robust program in place based on previous funding as well as federal funding that we get to be able to implement secret shopper-like programs. So we even through COVID have continued to do some of our surveillance work. That does allow us to go to retailers to make sure that they have the proper signage. We, through COVID, did temporarily halt the component where we had young people going into shops. So the secret shopper component with underage individuals, that was paused. We do anticipate being able to scale that back up again as the community spread continues to be reduced and as people get vaccinated as well. And again, that program, which is funded both through state dollars and through some of our federal dollars, allows us to actually go into shops and and young people will attempt to buy vaping products. And if they're sold the products, then there's a whole process that rolls out from there, to include training, or in some instances, the retailer may be fined. And so we do anticipate continuing those programs. On the marijuana side, we plan on implementing a program very similar, so secret shopper program, as well as public awareness campaign around underage usage of marijuana, similar to what we've seen related to some of the vaping products as well.
All right, well, I guess this is just a comment, not a question. It seems that the public is not convinced that what we're doing is sufficient. And maybe you could bring to the work group how the staffing lays out with regard to those specific programs associated with changing perhaps bad habits on the part of vendors, or corrective action. So however many staff people you have assigned to those specific tasks, that would be helpful if you wouldn't mind bringing that to the subcommittee. Thank you.
You're welcome. Yes, I can definitely.
Thank you for being here.
You're welcome.
Okay. Thank you, sir. Representative Dillon.
Thank you, Madam Chair. Hello, Commissioner. Thank you very much for the work that you do. For the work session at the sub level, could your folks provide more information about the line items on the front page here where the governor recommended less than the agency requested, and that would be Young Adult Services, Connecticut Mental Health Center, GA Managed Care. There are a number of those. So I won't list all of them, but the deltas vary, but would just like to unpack that a little bit. So that's number one. And the second, generally, the grant accounts were hammered pretty badly over a 5 or 6 year period. I guess I would like to have some knowledge going forward of whether or not our current system, either through that line item or enough, is providing enough access for substance abuse outreach and prevention and treatment. We just heard from the medical examiner earlier today, and we're looking at increases in deaths, and we've had a number of deaths that seem to have been related, from what the police tell me, to a bad batch. But I'm very concerned about what's going on about that, and you're part of the issue. If we can do prevention, obviously there's another level also on the criminal justice side. So if you could help us understand whether that we're providing what we need and to mental health and substance abuse.
Okay, yes, we can definitely bring that information to the subcommittee to include some of the programs and initiatives that we have in place that are funded through our federal funds for opioids and other initiatives.
Thank you. And just generic addiction, I guess, too. I don't know. I don't want to, but through state dollars. Thank you.
You're welcome.
Thank you, Madam. Representative Datham.
Thank you very much, Madam Chair, and thank you for your presentation today. I kind of want to follow on with my colleagues' questions regarding the regulation of use of cannabis. I am slightly concerned that the governor's budget hasn't had a good look at some of the issues that other states are having as a result of legalization. And I'm wondering if our sort of margin that they've assumed from this revenue really is the right cost. I mean, really is the right thing And I was hoping that you could bring to the working group your underlying assumptions for other areas that you might have additional costs outside of the regulation. There is a whole bunch of issues that we would see in terms of increased addiction, other, services, other mental health issues, other rise in other healthcare costs for people as a result of this. And I'm wondering if you've had a chance as an agency to look at the experience of other states, because we have the hindsight of, several states in our nation that have legalized it, and would like to understand how we are anticipating those costs going forward. That's my first question.
Okay, thank you. I mean, we have, certainly, been in discussion with some of our regional states. So other states in this area. I participate in regular meetings with other commissioners. One thing that is a theme across many of the approaches, and so, of course, Massachusetts would be in this group as well, is, the secret shopper programs. That's one way to ensure that underage individuals are not, don't have access or aren't sold cannabis products. And then the other piece that is a theme across many states when the commissioners get together is the piece around public awareness. So really, doing the prevention awareness campaigns and getting information out about some of the challenges with underage usage of cannabis. We do plan to implement some of those practices, which increasingly we're seeing are becoming evidence-based practices for those areas where cannabis is legalized. It would be part of our approach to implement similar programs that speak directly to underage individuals that may have access to marijuana, to cannabis. And so those are certainly two things that we would look to implement.
Yeah, again, I'm very much worried about the addictive nature of some of these drugs, because we're not talking about the pot of 30 years ago. We're talking about heavily processed, high concentrated levels of THC, which are found to be much more addictive, particularly in younger people. So I'm glad to hear that there is a focus in on how we're going to do that. But I'm also, again, just really concerned overall about mental health, paranoia, other sort of issues. And I would be very surprised if Massachusetts hasn't experienced increases in issues as a result. So I'm just wary that our assumption for expenses is light here, but would love to hear more about your experience in looking at what Massachusetts has to do. My second question really is around the consolidation of the human resource function. I know you had 45 people that transferred out of your agency, and your agency is really, a high touch agency for our state. And just want to make sure that with that move, that your agency is able to work, efficiently, effectively, serving, your employees in a better capacity without having that function in your agency. And would just love to hear more about how that seems to be working out for you guys so far and going forward.
Yeah, no, thank you for that question. I mean, thankfully, the way the consolidation has been structured, we do still have a number of on-site staff. So our previous HR director has remained on-site, and we're on-site virtually since we're virtual, although Jennifer Green, our HR director, at times is at other facilities. But, we do have a number of on-site staff, that we're able to connect with regularly, even though they technically will be part of the DAS sort of payroll and DAS team. But it's been structured in terms of pods, so content pods. So the individuals that we're working with assist with things like recruitment and labor relations. We have one major person who was previously our director, who in many ways serves in that similar role. And we're able to connect with that individual regularly around the range of HR functions that we did in the past. So, in terms of creating an efficiency that still hits all the main areas that are critical for us as an agency, we've been able to still maintain all of those core functions that are needed to operate our agency efficiently.
Okay, great. Thank you so much. I have other questions. I'll bring them to the working group or let the administrator know. Thank you, Madam Chair.
Thank you. Thank you. Representative Ferraro.
Thank you, Madam Chair. And thank you, Commissioner, for coming before us today and answering our questions. I just have a couple of quick questions. One on the 390 vacancies that you mentioned. Historically, year to year, what is the number of vacancies in your department?
I don't have that exact number in front of me. Stephen or Nancy, would you have that? We do generally have some vacancies year to year, and I can bring that to the work group meeting. We are, I would say, higher right now than we've ever been, but can do an analysis and get those exact numbers.
And if you were to qualify that, you would say very much higher, right?
Stephen, do you have any of that data? Can you?
I don't have any of the data, but it's just anecdotally, I would say that we normally have probably around 200 vacancies. The 390 is high. And as the commissioner said, it has to do with probably docs, nurses, but the fact COVID also, I think, has impacted as well. Is bringing new people into our system has been a challenge because of the people we work with is difficult. And with COVID, it just adds another layer of people not wanting to work on an inpatient setting. Most of our vacancies are out of the inpatient units, which is our challenge.
Okay, so it might be fair to say that once COVID is behind us, that some of the trepidation about coming to work could go away and some of these vacancies would be a lot easier to fill. Would you agree with that?
I would agree with that.
Okay, and then moving on, going to the deficiency area, I heard the figure of 8.9 million in 2021, but as you know, the biannual budget covers 22 and 23. So I was just wondering, do you have any projections for deficiency going 23 and 22 and 23?
So for, we can bring that information in terms of the projections. I mean, what's in the budget is that, we're projected or anticipated that about 6.2 million will be added to our budget to address some of those areas, some of those accounts where we have had deficiencies in the past. We anticipate that those additional resources will help with stabilizing some of these accounts. Particularly some of the accounts that we had, where we had deficiencies, in many respects, some of the things were one time. So for example, we had high facility costs in our OE. In some of our units, we created negative pressure, system so that the air vents outwards. That's done already, so we don't have to do that again. So we have some maintenance things that were really one-time costs that we don't anticipate having to do again, given that they've been done already. And so, while our deficiency was about 8.9 million, we believe I believe the 6.2 million that we've received will certainly assist with stabilizing some of those accounts that are unpredictable.
All right, thank you, Commissioner, and thank you, Madam Chair.
Thank you, sir. Where is she? Hello, Representative McCarty.
Thank you. My button wouldn't work to let me, I was listening the whole time, but I wanted to welcome Commissioner and Mary Kate and thank you for your testimony. And I just was curious, Commissioner, I don't know if you've thought about this, but we have looked throughout the pandemic at the use of telehealth services quite a bit. And I'm wondering if the department is taking a look going forward as to how using telehealth and to continue with integrated services. I know particularly for our behavioral health services that could be very beneficial. And just curious if you might be able to bring some information to the working group so we can continue to monitor the telehealth services and how that impacts your department and whether you see that you'll have greater need in the future. That's one. And then I do appreciate the department and not losing sight of our substance use disorder and all that we can possibly do with the opioid pandemic. So if you could bring more information to us on what the department is doing in that regard. And then finally, I am too also worried about the funding piece for our private providers. So maybe some more detail in that area. Sorry, quite a bit there, but I want to thank your department and particularly for the cooperation with looking at our regional behavioral health organizations. I know you've been very cooperative in that regard, so I appreciate it very much.
Thank you. Thank you, Representative. Representative Candelaria.
Thank you, Madam Chair. Commissioner, nice to see you through Zoom.
Hi, good to see you. Thank you.
Just a quick question. First of all, thank you. I saw the budget for Connecticut Mental Health. That wasn't cut for the first time, I think, in I don't know how many years. So that's good news. Secondly, is that through this pandemic, we have seen an increase in patients who have developed mental health conditions, right? And what I've seen is that it's the level of funding for grants for mental health has been stabilized. I didn't see an increase on that. I'm assuming there is an additional need based on what I'm hearing. I know that Representative Walker currently, I think she asked at the beginning, and first let me apologize. I'm actually on another meeting on my phone. So it's probably you already addressed this, but I know that Representative Walker talked about if you receive any COVID dollars. And if that was the case, how were those dollars utilized to address the increase, at least to provide services, medical services, behavioral health services to these individuals? Secondly, I am concerned that we still have not really passed this pandemic hump, and there's still going to be a lot of need. We've seen an increase of people who have committed suicide because of isolation. And how can we invest more dollars in these areas to at least to do the prevention piece of it?
Yeah, no, thank you for your question. I mean, you know, so thankfully we have received quite a bit of federal funds that have assisted, and in many ways that helps to, add additional services and supports to our system. Through some of our SAMHSA dollars, we've been able to expand some of our mobile crisis teams to include adding additional staff and expanding their hours. The nice thing about that is that through the pandemic, if people are in crisis, the teams have been able to go out and still connect with people and triage them to needed services and support. So that's one area where we brought in additional resources. We've also been able to actually hire additional staff who are functioning as crisis counselors. We have a collaboration with Reverend Robert Anderson where we've brought in 12 crisis counselors that are working with the churches all over the state, in fact, to work to connect and engage with people at a community level who may not traditionally come into services and supports. And so that's another initiative that we have. We've also been able to expand some of the resources and supports for 211 and have an ongoing collaboration with them to include recently adding an action line. The action line, it consolidates our mobile crisis line as well as our suicide lifeline. And so now 211 functions as a hub for that. To be able to provide counseling over the phone, but connect people to needed services and supports. I had mentioned earlier that another area of funding that we've received through FEMA and now SAMHSA, that the funds have been combined, is our Coach initiative. That's allowed us to develop a public awareness campaign around the availability of services and supports around the state, but also has, again, people can connect with an individual live, a coach who then helps to triage and connect them to other services and supports. The Coach website then actually serves as a really valuable information hub for people related to whatever behavioral health services they may need, whether it's mental health or addiction services and supports. And so that all has been funded with our federal resources as well. So those are just some of the areas that we've had funded. For healthcare providers, so I just want to add this one piece. One thing that we've all been hearing about is, healthcare providers are maybe particularly challenged. Some people may be working long hours, maybe experiencing vicarious trauma and vicarious impacts of the pandemic. So we use some of our resources to expand EAP services and supports for our community private nonprofit providers, so that individuals can have some of their, so that those supports are expanded and available for community providers. So those are just some of the things that we have in place.
Thank you for that answer, Commissioner. And also, and I think Representative Dathan touched upon it, but we'll move forward with the cannabis bill. We'd like to see what the department will do to address, right? Not only because there's other underlying, right, issues with that, but when we're looking at addiction services, I think that's a big piece that we need to address, and prevention services specifically for our youth. So I think that's something that needs to be worked on, and there's not much detail on that in that area, but I would like to hear at some point later on, probably in the work group, what are your thoughts on that? So thank you for your time.
Thank you.
Thank you. And I still want to get the COVID dollars and how you disperse them through the agency. And I know you did not do this budget. So I'm going to be gentle, but not really, because if you look at your budget, as Representative Dillon pointed out, Connecticut mental health, I don't think Representative Candelaria realized that is less than what you had asked for. The governor gave you less. In the general assistance managed care, what you asked for, the governor gave you less. In young adult services, what you asked for the second year and the first year, the governor gave you less. In forensic services, the governor gave you less. And when I gave up a total in your budget, in total for the 2 biennium years, it's $67 million less. And in a time where people, as many people have mentioned, mental health, if anything, should be raised up. And that is, it's not you. I know that. So please, again, I'm not angry with you. I am angry with what I see for diversity and equity and addressing the issues that are going on in our state right now. This budget has been cut by almost $100 million. Kids haven't been in school for over a year. Suicide rates, issues that are going on. Parents are crying for help. People have been out of work for almost a year. That in itself, mothers don't know whether they're going to have childcare, and they still have to have multiple jobs. Nonprofits are crying because they can't, they're closing. This in itself should have been the one agency that got all those dollars. Should have been where a lot of our COVID dollars should have gone to. Healthcare, death, and despair are running rampant through the state. And this is what is given to us to address it. I am so sorry. I so apologize but it's just, I mean, it's almost going to bring me to tears because I've been on the calls with people that have said, I need help. I need mental health services. My child, I can't even get him to eat food. I can't get him to come into the house. He's terrified. My husband is depressed because he cannot find employment and he feels like he's less of a man. And I could go on and on and on. So we'll have a much more robust conversation, ma'am. And I let us be the bad guys. I don't care. I'll be the bad guy. But I'm not going to turn my back on it. And I know you will not do that either. And you did not do that. But taking all of these dollars away from mental health, which was you guys were not funded well for the last couple of years. And my one question is, under the FMAP, have we expanded any mental health services under the FMAP to allow us to try and get some matching dollars from the federal government?
The FMAP, what?
So we, through our longstanding, the past couple of years program that we have is behavioral health homes that focuses on mental health, and that had an enhanced match initially. So that was one of our premier programs that continues also to bring in revenue.
And we're getting, the enhancement, we get what is it, about 7% more? No, it's more than that. I forgot, but yes.
It depends on the eligibility group.
Okay, so could you bring that to the working group, please? Whatever Medicaid dollars that you are getting that is enhanced, we'd like to know. And particularly, I want it focused, and the other part that we probably need to look at is, as the commissioner pointed out, you guys are looking for psychiatrists and things like that. And I'm sure in our corners like the Northeast and the Northwest, we are woefully underserved. So if we could look at where those vacancies are when it comes to the state, I would really like that too, because I'm surprised my co chair is not on lifting on here, but she's on 3 other Zooms over there right now, probably. Thank goodness for us. But she's brought out to me over and over again the lack of mental health services out in her area. So I would really, if you can help us understand, where are your deficiencies? I mean, we may have to, breathe. We may have to look at multiple tiers for funding for positions and everything. What we know, Fairfield County pays more for nursing homes than in New Haven or Hartford, so mental health should be part of that also. But we've got to provide people with the respite needs that they need to try and get themselves back into the swing of our lifestyle and everything. And we've got a lot of children that need desperate help. And so we've got to be the ones to understand it and reach out for them. And I mean, kids all over the state. It's not just in urban areas, it's everywhere. And the calls that I get and the emails that I get a lot from the northwest corner. And it just bothers me, so that we need a lot of work. And I thank you. I really thank you for all you guys do. And I just hope that we can work together. You can talk to us and give us some ideas. Hi, Co-Chair, you're back. You can give us some guidance and let us try and help you. And even if we can try and enhance those dollars over the next couple of years with some of the COVID dollars, I know there's a cliff, but maybe it'll give us enough time to try and mend some families that are broken behind this horrid disease that we've been going through with these deaths and everything. So thank you all for your time and your dedication and your patience and your calmness. And Commissioner, you are so patient and calm. It just drives me nuts. I'm freaking out over here, and you are, but thank you. Senator Austin, Senator Minor, Representative France. Do you have
anything else you want to add to that? Or?
I have nothing. Thank you.
Okay. We're good? Okay, we're good, Senator Minor?
Yes, we're good, but I certainly do share your frustration and the concerns you've expressed with regard to the Northwest corner. It's not a secret. And COVID dollars, I think, probably would be very helpful over the next year to try and bridge what clearly is going to be a significant ongoing problem for the next year or two. I always hear from parents with children, and they are at their wits' end. And it's only gotten worse because of COVID. So we should have a broader conversation in the subcommittee. Thank you. And thank you for being here, Commissioner, and your staff.
You're welcome. You're welcome. And happy to sort of participate in the follow-up conversation. We'll provide the various information that was requested as well.
Thank you. And thank you, everybody. Have a wonderful afternoon. Thank you.
Thank you. You all as well. Yep. Take care.
Okay. So that ends, we're early, and, can't say that Approps runs over all the time, most of the time, but this is not one of those times. So I thank everybody. Madam Administrator, do you have any marching orders for us?
I do not, Madam Chair, and much as I love you all, I won't miss you for the next couple of days.
Thank you. Everybody have a good afternoon. Thank you.
Take care.
Bye.
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 Thank you.
Hi, take care.